Welcome to the Deep Dive. Today we're diving into a topic that frankly can feel like you're navigating a dense jungle: healthcare planning. And more specifically, we're going to try and demystify Medicare Part D. That's your prescription drug coverage. Our mission today is really to show you why understanding it isn't just, well, a good idea. It's absolutely crucial for your financial well-being,
Yeah.
especially since things can change so fast. So the core question we're unpacking is deceptively simple. Why does enrolling in Part D matter, even if you don't take a single pill right now?
It's a great question, and it's one I hear all the time, and I totally get why Medicare, just in general, can feel like this information tsunami hitting you. So our goal here is to bring some clarity to that, distill the vital info, and really connect the dots for you. We're not just going to define Part D. We want to explain why its nuances are so critical and highlight some, well, surprising financial implications that, unfortunately, a lot of people only discover when it's a bit too late.
Okay, so let's start right at the beginning then. When we talk about Medicare Part D, what exactly is it? What's its main job?
Right. So at its core, Medicare Part D is there to help you pay for prescription medications. It's a really vital layer of coverage for millions of people. What's often fascinating, or maybe a bit confusing for people, is that these plans aren't offered directly by the government, by Medicare itself. Instead, you get them from private insurance companies. Now, these companies are approved by Medicare, which is important, and this setup creates this landscape of options, generally fitting into two main buckets. You've got standalone plans, that's what you'd likely choose if you have original Medicare, or the coverage might be built directly into a Medicare Advantage plan, sort of bundling your medical and prescription coverage together.
Ah, okay. So private companies, but with government approval. That makes sense. But it sounds like it could still get complicated with what's actually covered, right? What kinds of meds are usually on the list?
Absolutely, yeah, that's where the details matter. Generally, these plans cover a really broad spectrum, both generic and brand name drugs. We're talking about medications for common chronic conditions, things like diabetes, high blood pressure, cholesterol, asthma, just to name a few. And it's not just pills either. A lot of vaccines and injectable medications that aren't usually covered under your Part B, they often find their home under Part D. So it aims to be pretty comprehensive, covering a big chunk of your pharmaceutical needs.
That sounds really broad, which is good news. But I guess here's where it often gets a bit tricky for you, the listener. Each of these private Part D plans has its own specific list of covered drugs. It's called a formulary. You can think of it like, I don't know, a detailed menu just for drugs. Each plan has its unique list.
Exactly. And within that formulary, the drugs are often put into different tiers, and those tiers directly dictate your out-of-pocket costs.
Ah, the tiers. Right.
Yeah. So understanding your specific medications and how they fit into a particular plan's formulary and its tiers, that is absolutely essential. It hits your wallet directly.
Okay, and speaking of wallets, let's pivot to the really critical financial stakes here, because this is where being prepared is just paramount. The cost of prescription drugs isn't just high, it seems like it's rapidly escalating. And not having coverage can be, financially devastating.
It really can be. It's a stark reality. Let's look at some real examples from our sources to make this tangible. Take insulin, for instance. Without decent coverage, we're seeing people pay upwards of, say, $300 per vial, sometimes much more.
$300.
Yeah, and it's not just the super high-cost specialized drugs either. Even basic generics can easily run you $50 to $80 out of pocket if you don't have drug coverage. And the crucial thing to grasp here is that these costs, they aren't slowing down, they're just continuing to climb. So imagine for a second, you get diagnosed with something unexpected, you suddenly need a medication you've never even thought about before, you're not covered. Those abstract costs suddenly become very, very real and fast. So even if you're in perfect health today, you don't take any meds, it really only takes one diagnosis, one unexpected health event to completely change your financial picture. This isn't just about managing what you need now, it's really about protecting your future self.
That's a really powerful point. And it gets even more complicated because, like you said, a lot of people just aren't aware of what happens if you delay enrolling in Part D.
Especially if you feel healthy now. We're talking about something called the late enrollment penalty. And it's a detail that can, haunt your finances for the rest of your life. It almost feels punitive when you first hear about it. Is there a reason for it?
There is, and it's a really crucial detail. Medicare put it in place basically to encourage people to enroll when they're first eligible. Think of it like this. If everybody waited until they got sick to sign up for drug coverage, the insurance pool, the risk pool, would be completely unbalanced. Premiums would have to skyrocket for everyone just to cover the costs. So to keep the system stable, the penalty encourages participation right from the start. Okay, that makes sense from a system perspective. So how does it actually work?
Right, so here's the mechanism. The penalty applies if you delay enrolling in Part D and you don't have what Medicare calls creditable drug coverage. Creditable means coverage that's at least as good as Medicare's standard plan. Maybe you have it through a current employer plan or the VA, something like that.
Okay.
But if you don't have that critical coverage and you wait to sign up for Part D past your initial window, Medicare charges you 1% of the national base premium. And that's for every single month you go without creditable coverage after you were first eligible. And here's the absolute kicker, the thing that really catches people off guard. That penalty isn't a one-time thing. It's not temporary. It gets added to your Part D premium for life.
Wait, for life?
Yeah.
Seriously, so it's not just like a fine you pay once?
Yeah. Exactly. For the entire time you have Part D coverage, it's a permanent surcharge. Right now, the national base premium is around $34.70 a month. It changes slightly each year. So let's just run a quick example. Say, for whatever reason, you waited 24 months, 2 years past your initial enrollment period without having other creditable coverage.
Okay.
That's a 24% penalty. Multiply that 24% by the $34.70 base premium. That translates to roughly an additional $8.33 added to your premium every single month.
Wow, okay. $8.33 might not sound like a fortune initially, but month after month.
Precisely. It adds up significantly, especially if you're on a fixed income. And it gets worse because it doesn't just stay at $8.33. As the national base premium potentially increases each year, your penalty amount also increases because it's calculated as a percentage of that base.
So it grows over time.
It's a persistent, potentially increasing cost.
Yeah.
So yeah, to reiterate, waiting. It is definitely not free. It comes with a permanent, escalating financial consequence.
Gosh, I know that all this information, percentages, penalties, formularies, tiers, it can feel incredibly overwhelming. It's just a lot to keep straight. I remember when I first started looking into this stuff, my eyes just kind of glazed over. But here's the good news for you listening. You really don't have to figure this all out by yourself, and we want to introduce you to a specific resource, someone who is genuinely a trusted guide and can make sense of all this for you. Her name is Rachel Carroll. She's a licensed Medicare agent, and she's based right there in Alamogordo, New Mexico. Now, Rachel isn't just, some voice on a 1-800 number reading from a script somewhere far away. She's local. She actually listens to your specific situation, your needs, your budget.
That personal touch is so important.
It really is. And she provides personalized guidance. She can sit down with you or, chat over the phone and walk you through exactly which Part D plan works best for your specific medications, if you have any, and your budget. And it truly doesn't matter if you're currently taking 5 prescriptions a day or if you're perfectly healthy right now and taking absolutely none. Her expertise is invaluable either way. It's about being proactive.
Yeah, the value of having that kind of personalized expert assistance. You just can't overstate it when you're navigating decisions this complex and impactful. I mean, these aren't minor choices you're making. They directly affect your financial stability down the road and your access to crucial medications when you might need them most. And even if you're listening right now and thinking, oh, no, I think I already missed my initial enrollment window. Maybe you've been without coverage for a while.
Right. People might be worried now.
Yeah. But Rachel can still help. She can guide you through understanding what your options are now and even help you figure out how to minimize any potential penalties you might be facing. It's really never too late to get informed, but acting quickly once you are informed is absolutely vital. Don't let that penalty clock keep ticking if you don't have to.
Okay, so let's bring it all together. What does this all mean for you, our listener, as you move forward from today's deep dive? Let's just quickly recap the core insights. First, remember, Medicare Part D is there specifically to cover your prescription meds, a really fundamental part of healthcare. Second, those drug costs. They aren't just rising, they are increasing relentlessly. Trying to self-pay is becoming an incredibly risky gamble.
A big gamble.
Third, delaying enrollment in Part D, even if you feel perfectly healthy today, can lead straight to permanent escalating penalties. They get added to your premium for the rest of your life. And finally, even if you are perfectly healthy, taking 0 medications right now, you are still financially at significant risk without this coverage because life happens. So the urgency here is real. Don't panic if you've just realized you might have missed a window, but please, whatever you do, don't wait to address it. Think of this as preventative financial health.
Exactly. And this really connects to that bigger picture, doesn't it? It's about long-term peace of mind, financial security, being proactive with your healthcare coverage, especially something as foundational as prescription drugs. It just protects you from those unexpected, potentially huge costs later on. It helps ensure you can actually get the medications you need when you need them without facing that awful choice between your health and your financial future. It's all about being prepared, rather than being forced to react when a crisis hits. That makes all the difference in your quality of life down the line.
Absolutely. And again, if you're looking for that trusted guide, that person who can really break this down for you specifically, especially if you happen to be in or near Alamogordo, New Mexico, or even if you're listening from San Antonio or somewhere else you might cover, reach out to Rachel Carroll. She really is the kind of person you want in your corner for these crucial decisions. You can reach Rachel directly. Just call or text her at 830-282-6994. That number again is 830-282-6994.
Yeah, having someone local and knowledgeable makes a huge difference.
It really does. So as you go about your day, we want to leave you with one final, maybe provocative thought to consider. Think about how a seemingly small decision today about whether or not to look into your prescription coverage could profoundly impact your financial freedom and your health choices decades down the line. What unforeseen medical needs might pop up 5, 10, even 20 years from now? And how truly prepared will you be if you don't take action and secure that coverage now? The future is always unpredictable, but you're planning. That doesn't have to be.